Hi, everybody. Welcome to the Social Work SIG webinar. And this webinar is titled, let me get it right real quick, Doing What We Do Best. Let me pull up the full, sorry, I am on the wrong screen and I'm feeling unprepared. All right, doing what we do best, social work applied to African Americans. And we have Dr. Jennifer Payne, who's done a lot of work around, would you call it culturally tailored acceptance and commitment therapy, Jennifer? Is that an appropriate term?
Yeah, yes, it is.
Okay,
yeah.
Okay, perfect. And so Dr. Jennifer Payne, just a brief introduction, because I know she's going to introduce herself more, is affiliated with Kennedy Krieger Institute in the Center for Child and Family Traumatic Stress. She's also a member of Department of Psychiatry, Division of Child and Adolescent Psychiatry with at Johns Hopkins University. And we're just really, really thrilled about having her. Again, she's going to say more about herself, but I will say we do have some more upcoming webinars. We've got a lot of ones in the hopper, and we don't have any officially scheduled right now, but please be on the lookout for additional webinars that will be coming down the pipe. And if you have any ideas about things that you would like to see that are specific to CBS and ACT, but can incorporate other things as well, but that are specific to CBS in some way, then feel free to email the SIG and let us know, or feel free to put them in the chat. And I'm going to hand it over to Dr. Jennifer Payne.
Okay, great. Well, it's wonderful to be here. Thank you so much. Thank you, Jack, for asking me to the Social Work SIG. Really appreciate that. And so today we'll have a conversation about social work applied to acceptance and commitment therapy. But I know that you already got a little bit of information about me. So it was already said that I'm a research scientist at the Kennedy Krieger Institute in the Center for Child and Family Traumatic Stress. And then also I'm an assistant professor in the Johns Hopkins University Department of Psychiatry. But one of the things I feel honored is that I'm kind of a pioneer, because I'm the very first social work trained PhD that was ever hired at Kennedy Krieger. And so, I was really hired to coordinate the acceptance and commitment therapy clinical services within the adult segment of Kennedy Krieger, which they don't have it right now, but we're in the process of getting that off the ground. And so in terms of my background, I'm a social worker through and through. And I received my MSW degree from Cal State University, Long Beach. And my doctorate is from, I have a doctorate in social welfare from UCLA. And so today, these are the learning objectives for today. First, we're going to explore how social workers really are the ones that have the perfect backgrounds to help oppressed communities when it comes to ACT. And then second, we'll be looking at a culturally tailored ACT model that I developed for African Americans as a case example. And so we're going to focus today really on two parts of the 6 portions of the hexaflex. We're going to really be looking and digging into values and committed action. But first of all, I kind of want to, just talk about what makes social work unique. And most, if you're a social worker, you know this already. But as I said, I'm a social worker through and through, and I've been educated in other disciplines as well, not just social work. So, for example, I have a BA in psychology, and I have a master's that I'm working on in psychology as well. But social work is my first love, and it's because it's so special, it's so unique. And this is the primary therapeutic discipline that's based on systems theory that uses person and environment as a lens to work with people. And so many other disciplines have come on the bandwagon of late, like I say, within the past 5 to 10 years, that they have started to say, oh, yes, you need to look at a person holistically. However, we have always done that as social workers. Systems theory is really just as much a part of what a social work journey is as is social justice work. And so, it really makes a lot of sense not to just look at symptoms that a person is having, but also to look at the context of the symptoms, right? So like the micro, the meso, the macro systems that are all impacting on a person. And so we, as social workers, we know that these systems that a client are involved in can impact them just as much as their own personal struggles. And so when we, as social workers, kind of do an assessment of a client, we're really good at assessment. We take the biological, the psychological, the social, environmental, the cultural considerations into the assessment process. We're really good at that. But I guess, I'm concerned about what happens when we get to the intervention phase with the client. So of course, we know what best practice is. It's best practice for us to use evidence-based practices or evidence-based interventions to treat our clients. But for some of our clients, like when we think about our marginalized or our oppressed populations or our diverse populations, when you use an EBP with them, some people, it's like trying to fit a square peg in a round hole. And so I'll explain that a little bit more. So first of all, when we look at our evidence-based practices or EBPs, they're geared towards an identified patient. They're really individualistic in nature. So in other words, they focus on that person that's right in front of you. So we're looking at their feelings, we're looking at their behaviors, but really, our clients, when they come to us in therapy with a pain that's not just due to individual issues, but a lot of our clients come into therapy with a pain that is from systemic issues. And really EBPs are not, really equipped necessarily to address that. A second thing that is kind of an issue is the issue of medical necessity. And so most therapists who are doing billing of some sort, they have to establish medical necessity. And so basically what that means is that, they definitely have to have a clear reason to give that client treatment. They have to have a clear problem in order to give that client treatment. And so what that ends up doing is it leads to some type of mandatory diagnosis of either depression or PTSD or some other diagnosis. But there needs to be a diagnosis in order to treat. And I can personally remember me being a supervisor at when I was part of Los Angeles County Department of Mental Health. And I remembered very clearly that there were, a lot of clients that came in, or not a lot, but there were a few that, did not necessarily fit into a diagnosis, but they definitely had stress. They definitely had problems. And sadly, we had to refer out. We couldn't see them because it wasn't billable. And so we have that mandatory diagnosis. In reality, the truth is there might be many clients that are out there that are just experiencing a normal response to a really toxic environment, or a normal response to a very traumatic or abnormal environment. And so really, what I'm saying is that anybody might have a problem if they were in that same toxic situation. So if they were having constant court problems, or if they were having an inability to be hired, or if they had no childcare so that they could actually get to work, or that they were having constant issues of racial injustice, anybody would have a issue with being in those situations. So that is not abnormal, but unfortunately, we have to meet medical necessity. Another thing about EBPs is that, they're proofed based upon randomized controlled trials or RCTs. And usually when they're proofed or they're tested on primarily homogeneous populations. So primarily white, primarily English speaking, primarily heterosexual populations. But then when you look at our clients and the diversity of the clients, like that there are times that we have diverse clients that are coming with pain that's sometimes culturally influenced. And then last but not least, like the EBPs that we have were for the most part created based on Western Eurocentric individualistic values. When in reality, there are a lot of individuals that we work with as clients that come from cultures that are more collectivist. So there's a few reasons why it feels sometimes like a square peg in a round hole. And so, as I use African Americans as an example, it's really well documented that African Americans underutilize mental health treatment. And we know this is for a lot of reasons, but could it possibly also be a reason that the fact that it just doesn't feel good to be a square peg in a round hole? I mean, that might be one of the reasons amongst many others. But we know EBPs weren't completely designed for people of a variety of cultures or with various experiences, with systemic oppression. And so we know, though, that the EBPs work based upon the randomized controlled trials and based upon the meta-analyses. They definitely work. But the problem is they work only for like those who, number one, have access to the treatment, number two, choose to trust the process, and number three, those who are motivated to participate. And I'll talk just a little bit briefly about a little bit more about that. So when we talk about access to treatment, it's very well documented that African Americans have access to less access to quality evidence-based treatments. And so let's even look at ACT, right? As an example. So there are very few ACT interventions available to African American clients when you think about it, across, not only across, the United States, but throughout the world. And in fact, there are very, very few African American ACT clinicians. And so access is a real problem for some populations. Secondly, in terms of choosing to trust the process, even if an EBP is available, if a person doesn't trust the process, then it's not going to work. And so there's a professor, Dr. Arthur Whaley, he coined the term cultural distrust. And what that is it describes the views that many African Americans have about mental health treatment. And that's due to the Tuskegee experiments, due to the fact that the history of psychology is fraught with negativity towards African Americans. There's many reasons. Due to the fact that many people don't necessarily trust the quote unquote system of clinical treatment. And so what many people will do is they will suffer silently, or they'll suffer with, these chronic emotional problems rather than actually going to a therapist. And then third, the person has to be motivated to treatment for the EBP to work. And so again, there are some problems in the way that interventions are applied to marginalized or oppressed groups. And so here you see some of the barriers to treatment that some African Americans may experience. And I do want to make a caveat and say that, it's not all African Americans. I don't want to put them in that box, but some African Americans experience these barriers to treatment. And so you see personal shame, cultural mistrust, poor insurance coverage, lack of transportation, computer access, And when I'm talking about computer access in, during this COVID-19 season, in terms of telehealth, cultural views on mental health, clinician bias or misdiagnosis, and then mental health stigma in the culture. It's interesting to note as you look at this list that most of these barriers are systemic rather than individual. And again, as we treat our clients, we use these evidence-based practices, which, again, I'm not downing them. They're the best practices. However, they are more individualistic and they really don't deal with or address systemic barriers. So I just want to stop here. I don't like rambling on for too long without stopping here and just kind of, getting some views from you. But so how do you guys, like those of you who have clients, those of you who have had clients in the past, how do you deal with the systemic issues that your clients present? And I would love, feel free to write in the chat, or you can, raise your hand, or you can just, open up your mic. It's any way is fine.
I'll just say really quickly about my experience in therapy. I'm no longer a clinician, but I am in therapy. But one thing that has worked for me is, and someone has said in the chat, the validation. I know I teach this as a social work educator and all of these things, but the fact that, when I say, wow, I'm a Black woman, in America dealing with these things, and to hear, yeah, of course you're stressed. Yeah, of course, that, and knowing it's not me and things that I should be doing differently, but how our world would need to change to fully embrace me, how everything going on with me isn't something that me individually has, conjured up for myself, but that sometimes it's just very much of being who we are, living in the context in which we live.
Absolutely. Thank you so much. So yeah, acknowledgement, which, and even that one thing sometimes we don't necessarily do as enough in our therapy sessions. Thank you. Thank you so much, Dr. Kim. Anybody else, or Jack, is there something in the chat?
We have a lot of people who are just basically, her saying a lot of the same thing, who are really agreeing with Rosalind, that, to validate, normalize, humanize, advocacy, ask, Pam said, ask them and don't assume I know what it is like to be them, validate, by making best value priorities to do, from Mohammed, invite and validate. There's just a lot, so I'm just kind of going through them. I hope I'm not running too quickly, right? Invite and validate conversation about navigating systemic issues. It's part of therapy. And then Felicia said, I work with many undocumented clients and my practice has to be a 100% fusion between clinical and systemic case management, advocacy, support due to systemic injustices.
Yeah,
I think we've got a lot of people saying pretty similar things, but also really important things, and some different things in there as well. And if I misquoted anybody, please turn off your mute and say you misquoted me.
Yeah, beautiful, beautiful. And I like that last thing that you said, a fusion between, case management, advocacy, and some of these evidence-based practices. Because, think about it. I'm just wondering, how come we don't have an evidence-based practice yet that addresses both issues, systemic and individual? So yeah, but no, those are great points. Thank you. So I'm going to kind of start talking about ACT in and of itself. So ACT is a very, good. It's of course a good intervention for many of us, and it does have potential when it comes to addressing both individual and systemic pain. When you look at different evidence-based practices, this one does have some potential in regards to that. And so again, using African Americans as an example, so ACT does have some benefits that may be appealing to the African American population. ACT is non-pathologizing. So again, like what I talked to you about even like the medical necessity and about having to have a diagnosis, you know, there's many approaches such as cognitive behavioral therapy and other approaches that have a goal of reduction of symptoms. So like, for instance, the goal of CBT is to reduce negative thoughts. And so you often need a diagnosis in order to do that. So you need a diagnosis of depression or anxiety to actually begin reducing the behaviors and the thoughts associated with that diagnosis. But ACT is different in that a client doesn't need a diagnosis to start off with. Instead, ACT really promotes the understanding that suffering is a part of the human condition. It's not a dysfunctional or diagnosable condition. ACT really normalizes suffering, and it normalizes pain, it normalizes avoidance as just, you know, regular human responses. But at the same time, you know, what the goal is to help people move towards more value-driven living. And so all of these things have been noted in research as appealing to the African-American community. And I'm sure it would be appealing to other oppressed or marginalized populations that is not stigmatizing. So ACT is great, again, because it normalizes pain and suffering. And as this is a slide where these are just in general, the factors that influence the experience of suffering for all people. So for all humans have these issues, or they have these things, these factors that influence their suffering. So their lifestyle, life stress, their social factors, beliefs about pain, whether they are predisposed to depression or anxiety, long-term health problems, fear of pain, and past pain experiences. So, you know, that's great. You know, all of us have pain, all of us have suffering, but when you look at marginalized and oppressed groups, the experience of suffering can also be influenced by not just individual, but systemic factors, right? So when looking at the social determinants of health model that was adopted by the World Health Organization, we can easily see that there's other factors besides, you know, just, you know, those universal factors that I just mentioned that are important to address in treatment. And so really, like, the World Health Organization defines social determinants of health as those conditions in which people are born, they grow, they work, they live, and they age. And really all of these conditions are shaped by the distribution of money, power, wealth, resources at the global and the national and the local levels. So when you look at like African Americans, these are additional factors that influence their suffering. So in addition to those things that I mentioned before that affect all people, for oppressed populations, access to care, illness chronicity, life stress, cultural competence, cultural or spiritual beliefs, racism, discrimination, socioeconomic status, police and prosecutor bias, stigma, cultural distrust, and past pain experiences. All of these are part of the social determinants of health, and all of these are things that also influence suffering. So these all should be things that should be included in what we're doing in therapy. And so actually the social determinants of health model and ACT can be very complementary to one another. And so there is an ability to be able to kind of create a more culturally tailored provision of ACT, not just for African Americans, but probably also other marginalized populations. And so just to I mean, most of you that are here, you don't need reminding about this, the pieces of the hexaflex, but these are the six parts of the hexaflex. And of course, we know that the whole goal of these parts of the hexaflex, or the core pieces, is to increase psychological flexibility in our clients and in ourselves. I know I use ACT for myself as well. But this is the model that I created, that is, based upon, again, like incorporating the social determinants of health model, as well as, doing some other like cultural tailoring to the ACT model. And so it's still the same exact 6 pieces of the hexaflex. Of course, the names have changed to be more, culturally influenced, to be able to, because remember what I said about just a little while ago about the underrepresentation of African Americans in mental health treatment. There needs to be something that motivates and draws to treatment. And so, like, definitely, if somebody's calling something diffusion, I'm not really feeling the word diffusion, but like freedom to let go is something that a person can understand a little bit better. And so, in terms of culturally tailored ACT, like the POOF model, and I'll say what POOF stands for in a minute, but the culturally tailored model that I have been working on, it provides, the use of culturally relevant metaphors for African Americans, as well as, the culturally relevant experiential exercises, some faith-based mindfulness or religious references, because those are important to the African American community, reality-based role plays, and of course, it's addressing racism and discrimination, addressing barriers to treatment, and addressing stigma and cultural views about mental health treatment are all incorporated in the model. And the model is presented as a group, and you'll see why as I talk later about we're going to be kind of focusing on values, and we're going to be focusing on committed action, those 2 parts of the hexaflex. But you'll see, like, you'll understand why it's important for a group experience as opposed to individual experience. But so it's 12 weeks, and the first 3 weeks are actually to kind of either to build rapport, build some closeness, but amongst the group, but also to give some psychoeducation, to really address the issue of stigma, because stigma is a big issue with the African American community in terms of utilizing mental health treatment, and then pain and suffering, but discussing pain and suffering from an African American perspective. That's what we do the first 3 weeks. Then, after we lay that foundation, then we get into the 6 portions of the hexaflex. So acceptance, diffusion, present moment awareness, self as context, personal values and collective values. So we get into those 6. And again, they're culturally tailored. But by the time we get to values and we get to collective action, we actually spend 2 weeks on values, 2 weeks. And please excuse me if you hear my dog barking, because he's so loud little something. But anyway, so two weeks on personal values, because we break it into personal values, and then we have a week on collective values. Same thing with individual and collective action. We have talking about individual actions that we could do, and then collective action. And I think those collective values and collective actions are really extremely important to add when you're working, with the African American population that is addressing the systemic problems. And so the goal of POOF is exactly the same. And like I told you, I would say what POOF is. POOF stands for pulling out a fire. So that's the name of it. pulling out a fire. And so the goal of POOF is the goal of ACT. It's the same exact goal. And so this is pretty much that I can be here in my own skin, right here and right now, the way things are, even in pain, even when things are not ideal. I move toward my best life. I can live my life like it's golden, even in the midst of mess. And so that's, got psychological flexibility is the goal of POOF, just like, it is for the goal of ACT. Okay, so just briefly, I'm going to show you the NHexaflex. So, I mean, the NHexaflex, and again, we've been, many of us are familiar with the NHexaflex and what does psychological inflexibility look like? What does it look like when you're stuck? What does it look like? And so POOF does the same thing again as ACT in addressing these areas. So again, I wanted to focus on two parts of the Hexaflex. So I'm talking about, again, values and then committed action. So let's talk about values for a minute. Many of us, all of us, like we're on this continuum, right? Of either being completely inflexible or completely flexible. And we're somewhere along the continuum. And so what is it like to live like I'm lost? What is it like to have a lack of values? So I know that, we talk about this, a lot in general, but what is it like to have a lack of values when you're from an oppressed population or where you're from, a marginalized group? So one thing about COVID-19 is that it has collectively caused us to have this experience of living from situation to situation. So some of us, we had to deal with, a lot of hard things the past 2 years, our loved ones getting ill from the virus or possibly even sadly dying. We've had to scramble to make adjustments in regards to those type of things. Some of us have had to deal with like very quick and immediate financial changes in our lives, or jobs lost, businesses being closed or shut down, having to adjust really quickly to working online instead of working in person. We've had to go through so many things like not seeing our extended or even close family members, like our parents, our grandparents, daughters, sons, like we used to. We've had to adjust to the gyms closing. We've had to, adjust to stores not having toilet paper. One thing about this is that it's given us a unified experience regarding what is it like to live from situation to situation. And for some of us, like COVID-19 has really exhausted us. For some of us, we haven't had vacations, we haven't been out and about, we have put out like most of our recreation on hold. We've had to take care of our children, like some of us like all day or even when the schools were closed. But we survived. We went into the survival mode and we survived. But I'm bringing this up because, I think about though that there's many African Americans, not all of them, but some of them. Some of us have had to be in the survival mode for 400 plus years. So in America, 400 plus years, well before COVID-19 hit. So survival mode happens when your paychecks are variable, when your loved one is unemployed, for some reason people don't hire them, when you're wondering if you're going to be able to pay your rent the next time that it comes up. If you're wondering if you're going to be able to feed your children tomorrow, like survival mode, because of the inequities of the social determinants of health, survival mode is more likely for underrepresented populations. such as African Americans. And so survival mode is actually a learned behavior. This is based upon these situations that take place in our lives. And if we have more traumatic situations, then we're more likely to be in survival mode, trying to survive. And all of this is important because some of us have never thought through how to move from surviving to thriving. Some of us have never thought about that because we're so used to putting out fires in our life from one crisis to the next, that living towards a value, that's almost foreign. That has not even been a thought. And so I'm not judging it because, I'm just acknowledging that we have had to do this. We've needed to be the strong man, the strong Black man, the strong Black woman. We've had to keep it together. We had to keep it moving in order to survive. So as you move towards talking to an African American that has this experience, because again, we all don't have this experience, but if you're talking to a client that has this experience you start to talk to them about values, it's very important to kind of understand that, that the issue of survival mode, and why somebody might be living like they're lost. Jack, are there any questions or anything in the chat?
Oh, I'm sorry. I thought I unmuted myself. Matt said, I like how collective action is tied to values. I'm excited to hear how collective values are distinguished from individual values for the specific client. And that sounds like an interesting question to me too.
Oh, cool. Yeah. We're getting there. We're almost there. Oh, cool. Yeah.
That's about it for right now. Yeah.
Okay.
Other than a lot of praise.
Oh, well, thanks. Okay. So, I usually like to, I don't know, we don't probably have a lot of time today, but I usually like to play this song. And so this is actually how the living life like it's golden got named, on the hexaflex, on the poof hexaflex. It's living life like it's golden instead of just talking about values. And the reason why is because not all, again, but many African Americans understand and know that Jill Scott, she's a musician. We understand and know this song, right? So I don't know. Let me see if I could play a little bit of it. It makes you want to bounce. It's hard not to. I'm taking my freedom, pulling it off the shelf, putting it on my chain, wearing it around my neck. I'm taking my freedom, putting it in my car, wherever I choose to go. It will take me far, and I'm living my life like it's golden. And so, I'm not gonna play the whole thing, but the lyrics are extremely helpful when it comes to talking about values. And I say that because again, having a values discussion, you just use the word values. It's a little diffuse sometimes. But everybody knows, what would it be like for you to live your life like it's golden? Oh, okay, yeah, I know what that, I can imagine what that looks like, and so that's the reason why it's called that. I want to get into the fact that, we talk about individual values with our clients, and that's great. Those of us who use ACT, we know the importance of values work, and even with oppressed populations or marginalized populations, it's definitely important to do, work with the individual values. But we can't just simply stop at individual values. So collective values need to be added into the treatment. So assuming that all the values are individualistic is really more of a Eurocentric kind of Western philosophy. So there's also collective values that impact upon African Americans. There should be space in the therapy room to discuss these as well. And then again, that's one of the reasons why, you know, a group kind of works a little bit better with this particular model than individual, even though you can use pieces of this in your own individualized therapy, but it works better as a group because the group kind of sustains themselves. The group becomes their own set of peers. They become their own village. They're able to bounce things and these values back and forth amongst each other. And so we know that the values, they're universal, but they're also culturally shaped. And so I'm not going to go into detail about these values that you see here on this slide, but each one of these are values that African Americans hold in terms of collective values. And the reason why they hold them is because of history. So, you have to understand history. History really can't be erased from the discussion. So I'll give you an example. So before slavery was abolished, African American families, they were torn apart as their parents and their children were separated. They were sold to different people. They were taken to various geographical areas. But instead of like bemoaning their fate, there were some African Americans that they started vowing to find their lost loved ones. They, even before the end of slavery, they started saving money. They started making plans to find those that they had lost and buy their freedom back. So that's why reconnection to family is such an important piece. That's why freedom is such an important piece. It's an important collective value. And I could actually, we could actually go through, each of these, in detail and like look at the history behind some of these collective values. But the point is that, yes, there's some collective values that, African Americans have that really would really positively impact treatment if they were working on it, even one of them. So if I'm working on freedom, or if I'm working on some, reconnection of family, or I'm working on something, that in these lines, it would be, really important to my to health and well-being. So let's talk a little bit about like collective action as well. So, the same spectrum, we can be on the spectrum all the way at inflexibility. We can be on the spectrum in terms of being very flexible when it comes to getting things done. We can be paralyzed. We can, in certain circumstances, on the other hand, we can actually be getting, something, done for ourselves, moving toward our values. So there's, a term, learned helplessness, which I absolutely abhor that term. But learned helplessness, that, it is a thing. I could think of the fact that fighting against the system, constantly fighting against the system in order to get your needs met is tiring, right? It's like being a salmon who constantly has to swim upstream, not just like during their reproductive cycle, but all the time. And so some African Americans, they can kind of give up fighting because of the energy that it takes to fight. Like the energy that it takes to fight against ongoing racism or discrimination or inequities, such as those that were laid out in the social determinants of health. Many people are just tired, hecka tired. So when you talk about committed action for African Americans, then you really do have to take into account that there is an extra push of energy or drive or whatever you call it for them to be able to keep going, to move from surviving to thriving. That extra, and just like what Dr. Campbell said, acknowledgement, just acknowledging the fact that, wow, I know, you got it, you're going uphill. It's like this is hard work, that you've had to do, and it's hard work that you still have to do. It would go a long way in getting a Black client to agree that committed action is needed. So yeah, I'm not going to go into detail about learned helplessness, but basically, when you think about that, you have this people that was and is and continues to be subjected to a number of adverse conditions like racism, discrimination, inequalities. It may help them to feel that they have no control over their situation. So it makes sense that some individuals might feel helpless, or that they might have developed a pattern of inaction to cope with their situation. And so, yeah, that's why I don't like the word learned helplessness, because I feel like you're kind of blaming the victim to some degree. But so getting it done. So again, like, we call it getting it done instead of collective action, or instead of just action in general. But when it comes to getting it done collectively, this is how kind of like a little script that we kind of get into the work of talking about the collective work that needs to be done. So again, if you like have a value such as freedom, or you have a value such as safety, and safety considering that George Floyd passed away, and that many other people passed away, and that many people feel extremely unsafe, just like jogging or going out, So this is one of the ways that you can kind of start the conversation. But it says, let's talk about the collective values work we did. We didn't just do that as a useless exercise. These are things that you've determined that you value for our culture, for your family, and for our community. So this is where we come together collectively. Those around you have been your peers and colleagues for the past 12 weeks. They're now part of your village, and it takes a village to get it done collectively. We can't do this alone. And so it's really trying to like help them to understand that this collective work is not something you can do by yourself. This is not like an individual thing. This is like systemic. Like if you're working against the system systemically, then you cannot do it by yourself. If you're doing it by yourself, you're going to burn out. You're going to get tired. But again, they need to create a village for themselves. And that village can even be expanded through other means. And so that's where, case management comes in. That's where, resource development comes in. That's where, linking people, linkages to like advocacy groups come in. But so research shows that those who move, even in simple steps towards improving their collective situation, whether it is through advocacy or standing up in small ways, 1 minute at a time, end up being more empowered, more enlightened, less depressed, less anxious, and they are contributing to making changes, no matter how small, in the world we live in and how things get done. And so it doesn't have to be a big thing, just like, when you talk about individual action, it doesn't have to be a big thing that they move towards. It could be something small. But the point is that they're moving, and when you feel like you're moving collectively, I mean, it really does help to empower you. And so, collective action. So I think like to add this piece to ACT, where you're really sitting with your client and talking about like some of the collective action that might work. It really helps to empower, especially those who are from oppressed populations. This is just a few resources in terms of like advocacy toolkits and in toolkits that help with peer advocacy. And then empowerment is like a big thing in regards to, like in helping to move people towards collective action. And so those, here's a couple of resources in that regard. So what are your thoughts on this? What are some other ways that we could incorporate things into ACT in order to help the systemic issues that our clients are facing?
Do you mean what we can do as a clinician, or what should we, like as ourselves, or what should we be doing with our clients? I just want to clarify.
It could be either one.
Okay.
Yeah.
Yeah, I actually heard that. I heard the question as how should we change ACT to be more, like more helpful for different populations as well, right? Like what can we do with our clients? And so that's just how I heard the question, right? But I think I've been sitting here wondering, like, how does ACT fall short too? Like kind of this, like, because I know it does best. Sorry, I don't want to derail the conversation.
No, gotcha. Yeah, no. Yeah, that falls in too as well. I know, Matt, you have your hand up.
Yeah, I was just thinking, this is really inspiring. I was just thinking that I'm interpreting it like Jack is interpreting it. And when I hear that, I think one of the problems that is in the ACT literature is that it's often described exclusively like an individual intervention. And I was thinking, like, what would it be like if in every ACT book that gets published, when people start mentioning values, they start really underscoring collective values being very important. And when we talk about action, we start underscoring collective action as a means of empowerment, as one option for the client.
Right.
So, I mean, I just work with a lot of sort of social justice oriented folks who feel really disempowered and exhausted and tired. And, we're often thinking about what can you do that is specific and actionable as opposed to being in your mind, because that's where the suffering lives, I mean, of course, there's going to be pain regardless. But I hadn't thought of it as what is the collective action you could take connected to collective values that would reduce your suffering. And so that's really exciting to think about.
Right. Okay. Well, thank you. Yeah, absolutely. Thank you. Yeah. Yeah. So I have there's an example. I have a client and I'm not using the group poof with the client. She's an individual client. However, this client has she has PTSD, and she has some very serious issues with the court systems. And that she's been going back and forth, and that's not going to stop anytime soon. Going back and forth in regards to custody issues from being with somebody who committed some heinous domestic violence against her. And so I've been working with her with ACT, but I've been also working with her in terms of some of the collective, not necessarily collective work that she could do with somebody else, but how can she link up with domestic violence advocacy groups? How can she and she's really and I've been encouraging her. Her name is Erin. So I've actually been kind of encouraging her to say, you're like Erin Brockovich, you're really good at this. You're like Erin B. You can do it. You can move, and really make a difference in helping other people that are going through the same thing that you're going through. And so she's really starting to kind of be an advocate, a self-advocate. She's starting to join groups. She's doing a lot of research for herself. And I think that's just as much a part of the ACT process for her as, some of the other things that we've been doing. So that's just an example. Any other thoughts? I think we're coming to time. Are there any thoughts in the chat, Jack?
Not a lot. There was so just going back to the last time I commented on the chat, there was just a lot of love for the song Golden, and Dr. Campbell talking about how it really, so I know I'm going back a fair amount, but talking to how it really speaks to African Americans who have a history of using music as an outlet. And then the idea, some people really liked the language that you use for the hexaflex and the inhexaflex, and the idea that that might work for just a lot of people here. It just resonates just in general as language for everybody else. And then that's kind of what we've got. Yeah. Oh, and Matt also made an interesting comment about, like, I think, Matt, you can correct me if I'm misquoting you, but the idea of collective action, having a feeling of self as context, right? You're part of being part of something bigger than yourself, has this self as context, like
Exactly.
tangible quality to it, which is really kind of neat. So
Yeah, no, I agree. Yeah, it's good. Yeah. Okay, well, I appreciate being here, and thank you so much for your time.
thank you so much.
If you have any, if you want more, if you want to know about the model, then you can go to that website. It's poofpullingoutafire.com.
And